মধ্যে আপনার আপনার হোমিওপ্যাথির জগৎটা হয়ে যাবে। এই জন্য আমরা চেষ্টা করি আপনাকে চাইনিজ ভাষায় কথা বলতে হবে। এই জন্য তোরা আমাদেরকে 1 বছর শুধু চাইনিজ ভাষায় শিখিয়েছে, এত করে আসলাম একদম। এই জন্য চেষ্টা, এবং ইংলিশ তো ধরেন আমরা কম বেশি, থ্যাংক ইউ, ইংলিশ আমরা কম বেশি ছোটবেলা থেকেই তো পড়ি, কম বেশি, কেউ বেশি করে কেউ কম করে। কাজে যদি আমরা একটু চেষ্টা করি তো ইংরেজি ভাষা না, ভাষা কথা বলা জানতামই না। আমার সৌদি আরব যাই সময় মনে হয়েছিল যে আরবিতে কথা বোধহয় বলে সুর করে করে। আমি হাসতাম যে রে সুর করে করে কিভাবে কথা বলবো, কিন্তু না, সুর করে তো না, আমাদের মতো কথা বলে। এবং ওতে বলার সময় লাগে যদি আপনার আগ্রহ থাকে, আপনার শেখার যদি উদ্দেশ্য থাকে। তো ইংলিশ তো আমরা কম বেশি জানি, সেটা আমরা কেন ইমপ্রুভ করবো না? আপনি মনে করেন রেপার্টরি শিখবেন, রেপার্টরির সমস্ত বই ইংলিশে, ভালো ভালো বইগুলা ওরা বাংলাতে পাবেন না। আপনি ম্যাথমেটিকার যে আধুনিক বইগুলা অত্যন্ত উঁচু মানের, সবগুলা ইংলিশে, এগুলো কেউ কোনোদিন বাংলা করেনি, করবে বলে মনে হয় না। তারপর আপনি ধরেন, আপনি যদি এই যে আমাদের যেটা ফিলোসফি বা ক্রনিক মায়াজম, সব উঁচু মানের বইগুলো সব ইংলিশে। আপনি যে মায়াজম সম্বন্ধে ভালো শিখতে চান, এই ইন্ডিয়ার বাংলা ভাষায় লেখা যে বইগুলো পড়ে আপনি তো মায়াজম ভালো শিখবেনও না, কিছুটা বরং ভুলও বুঝবেন। কাজে আপনাকে ইংলিশ শেখা ছাড়া ভালো হোমিওপ্যাথি শেখা বোঝার কোনো বিকল্প নেই। এটা আমি একটু বাড়িয়ে বলছি না, যারা আমার তো মনে হয় যারা এটা বোঝেন তারা এটা স্বীকার করবেন। কাজে আমরা কেন চেষ্টা করব না যে আমরা আমাদের ইংলিশ একটু বাড়াতে? এই জন্য আমরা এই ফোরামটা একটা সুযোগ করে দিয়েছি যে চলো আমরা ইংলিশে কথা বলি, ইংলিশে কথা শুনি, এবং যদি আপনাদের মধ্যে কেউ ইন্টারেস্টেড হন, এই ফোরামকেই আপনাদের কথা বলার আমরা ফোরাম হিসাবে আমরা আপনাদেরকে দিব। যে আপনি যদি একটা ভালো সাবজেক্টে কথা বলতে চান, আমি একদিন লেকচার দেব না, আপনারা একজন বলবেন। এইভাবে করে আমাদের ইংলিশের ফ্লোটা আমরা বাড়ানোর চেষ্টা করছি। এখানে আসলে ঘাবড়ানোর কিছু নাই, লজ্জারও কিছু নাই, আর সবাই সাবলীলভাবে এগিয়ে আসেই আমি মনে করি সঠিক। যেন বাংলাদেশে কেউ এই ফোরামটা করেনি, আমরা তো সাহস করে করেছি। এবং আমি তো মনে করি যে আমরা যদি সবাই যদি এর সাড়া দেন, এটা তো সফল একটা প্রোগ্রাম হবে। আমি বুঝে পাই না যারা এখানে আছে কিনা জানি না, যে যারা বিএইচএম স্টুডেন্ট, যারা বিএইচএমএস পড়ে, ওরা তো বেশিরভাগই বা সবই ইংলিশে পড়ে, ওরা তাদের জন্য এটা অত্যন্ত মানে ভালো একটা প্ল্যাটফর্ম এখানে যোগ দেওয়ার। বা যারা বিএইচএমএস ডাক্তার, তাদের জন্য একটা অত্যন্ত ভালো প্ল্যাটফর্ম, কিন্তু তাদেরকে আমি দেখি না এখানে। এটা আমি তোমার আবার খুব দুঃখের ব্যাপার এটা। তারা কি ভালো ইংলিশ জানে? নিশ্চয়ই জানে না। আমি চিনি বেশিরভাগকে, আমি পরীক্ষা নিয়েছি, পড়িয়েছি তাদের ইংলিশ ভালো না, হয়তো 2-1 এক্সেপশন থাকতে পারে। কাজে তাদেরও চেষ্টা করা উচিত যে যেন তারা ইংলিশটা আরো ভালো করে। কারণ আজকে তারা ইয়াং, আগামী দিন আমাদের মতো বয়স হবে, তারা বিদেশে যাবে, গিয়ে হোমিওপ্যাথি শেখাবে, হোমিওপ্যাথি লেকচার দিবে, সেমিনারে যাবে, সিম্পোজিয়ামে যাবে, ওয়ার্ল্ড কংগ্রেসে যাবে। আর ভাই ইংলিশ ছাড়া হবে না, বাংলাতে হলে আপনি পিছনে পড়ে থাকবেন। সেটা এখন থেকে যদি চেষ্টা করে, তাইলে এই বাধা কাটিয়ে ওঠার কোনো ব্যাপারই না। এটা আমি সবাইকে এই আহ্বান জানাই যে আমরা সবাই যেন চেষ্টা করি, না বুঝলেও বসে থাকি আর কিছু কথা শুনি না। এবং এই যে লেকচারটা আমি এখানে দিচ্ছি, এটারই বাংলা দিব আমি নেক্সট উইক, তো পুরাটা তো ওই সময় বোঝা যাবে, বাই চান্স যদি কিছু নাও বা বুঝেন। যেহেতু একবার বাংলা একবার ইংলিশ দিচ্ছি, পুরো লেকচারটাই বোঝা যাবে। এবং এই টার্মগুলো হবে অনেকগুলোই পরিচিত টার্ম হবে। আমার পাটুরি সাহেব, আপনি আমার মনে শুরু করে দেন।
জি স্যার, আমরা শুরু করতে পারবো। পার্টিসিপেন্টও অনেক আসছে ইনশাআল্লাহ। স্যার আমরা 30 সেকেন্ড সময় নিচ্ছি জাস্ট।
আচ্ছা আচ্ছা, ঠিক আছে।
স্যার প্রেজেন্টেশনটা হ্যাঁ আসছে।
জি
না স্যার প্রেজেন্টেশনটা পাচ্ছিলাম না, পেয়েছি স্যার, এখন আসছে।
আচ্ছা জি
আসসালামু আলাইকুম ওয়া রাহমাতুল্লাহি ওয়া বারাকাতুহু। বিসমিল্লাহির রহমানির রহিম। প্রিয় দর্শক শ্রোতা, সবাইকে আন্তরিক শুভেচ্ছা অভিনন্দন জানাচ্ছি বাংলাদেশ হোমিওপ্যাথিক পরিষদের নিয়মিত অনলাইন ভিত্তিক প্রশিক্ষণ ক্লাসে। দর্শক আপনারা জানেন আমরা নিয়মিতভাবে প্রতি রোববার এবং বুধবার আমাদের এই প্রশিক্ষণ ক্লাসটি পরিচালনা করে আসছি। এরই ধারাবাহিকতায় আমরা যেই আলোচনাগুলো করছিলাম, ধারাবাহিকভাবে পরে আমাদের আলোচনাগুলোকে আমরা প্রথমে ইংলিশ ভার্সনে উপস্থাপন করে পরবর্তীতে আবার সেগুলোকেই আমরা বাংলা করবো ইনশাআল্লাহ। তো আমরা গত সপ্তাহে যেই সাবজেক্ট নিয়ে আলোচনা করেছিলাম ডায়াবেটিস মেলাইটিস, যেটার হোমিওপ্যাথিক করণীয় প্রথম পর্ব আমরা আলোচনা করেছিলাম। আজকে আলোচনা হবে এর দ্বিতীয় পর্ব। আলোচনা করবেন আমাদের প্রিয় শিক্ষক ডক্টর শেখ ফারুক ইলাহি স্যার, অনারেবল প্রেসিডেন্ট বাংলাদেশ হোমিওপ্যাথিক পরিষদ। আমি স্যারকে তার আলোচনায় আজকে আমন্ত্রণ জানাবো। তার আগে অবশ্য কয়েকটি কথা আপনাদেরকে একটু বলে রাখতে চাই। সেটি হচ্ছে আমাদের স্যার পুরো আলোচনাটি ইংলিশে দেবেন। আপনারা যারা আলোচনা শুনবেন, আলোচনার শেষে প্রশ্নোত্তর পর্বে আপনি চাইলে আপনার প্রশ্নটি একদম বাংলাতেই করে আপনি যা বুঝেন সেই আলোকে আপনি প্রশ্নটি করতে পারবেন। স্যার আলোচনার যেহেতু আমরা পরবর্তী সপ্তাহে আবারও এই আলোচনাটিকে ইংলিশে বাংলায় উপস্থাপন করব, সেই জন্য উত্তরগুলো ইংলিশেই করবেন এবং পুরো আলোচনাটি ইংলিশে দেওয়ার চেষ্টা করবেন ইনশাআল্লাহ। তো আমি স্যারকে আলোচনায় আমন্ত্রণ জানাচ্ছি। আজকের আলোচ্য বিষয় ডায়াবেটিস মেলিটাস দ্বিতীয় পর্ব এবং হোমিওপ্যাথিতে এর করণীয় কি সেই বিষয়ে উনি বিস্তারিত আলোচনা করবেন। স্যার আপনি আপনার আলোচনা শুরু করবেন।
রাসূলুল কারীম। Viewers, homeopathic teachers, assalamu alaikum, good evening and adab. We started our topics from last week on diabetes mellitus, homeopathic approach. I am just giving you a little bit review of the previous class and then I shall proceed to the class today. So other day we discussed about etiological classification. There are 4 types of diabetes mellitus: type 1, type 2, secondary diabetes and gestational diabetes. I gave you detailed classification. Just I am giving you an overview of diagnostic criteria of diabetes. So I told you in my last lecture that how can you diagnose a case of diabetes mellitus by a single test, only by one test, very, very simple test. This is by making a random blood sugar. A patient comes to you and you write a test for him. This is random blood sugar. And he will go to the laboratory. Just he will come back after say 15 minutes only, because it takes only few minutes. If the test is blood sugar more than 11 millimole, then it is diagnosed decisively that he has diabetes, if it is more than 11 millimole. But the question comes, if he comes back with a result less than 11, say 9, say 8, then what to do? Then you are in confusion. So you will have to make another test there. either one FBS or fasting blood sugar, or you will have to go for OGTT, oral glucose test. So first 7. Then again it is confirmed that he has diabetes mellitus. He has diabetes mellitus. But the question comes, if his diabetes again comes, his blood sugar less than 7, but more than 6, then what to do? Then you will have to go for oral glucose tolerance test. Then you will have to diagnose it by this test, otherwise you cannot. So first only by random blood sugar you can diagnose. If it is more than 11 millimole. If you find it is 14, it is 13, it is 12, yes, you can diagnose it, yes, you have diabetes mellitus. But there will be a group. You will find that his blood sugar, fasting blood sugar, more than 6.1, but less than 7. If it is more than 7, he has diabetes. But he has less than 7, but more than 6.1. If he is in between this, you tell him IGT, impaired glucose tolerance test. It means he is pre-diabetic. He may develop diabetes afterwards. This is called pre-diabetic, IGT. So again, if you have IGT, you must take care. You must take care of your lifestyle, your food habit, exercise like that. Otherwise, there is all possibility that you will develop diabetes in later life. Now I told you also the difference between type 1 and type 2 diabetes mellitus. I discussed about type 1 and type 2. Type 1 is the diabetic patient who has less insulin. He has absolute deficiency of insulin. This is type 1. By type 2, he might have enough insulin, but there is resistance to insulin action, and insulin does not secrete well, then it is type 2. So I give here one table of differentiation. Say type 1 diabetes mellitus, they are usually less than 40 years. If you find a boy of 16 years having diabetes, then you know it is type 1. Because type 1 usually he will never develop type 2 diabetes, the mellitus, at the age of 16 years, 20 years. But if he is more than 50 years, with all probability you can say he has type 2 diabetes. Then duration of symptoms. When a diabetic comes to you and diagnose that he has diabetes, and it is since months or to years he is suffering, this is type 2. But type 1 will only suffer for few weeks before being diagnosed as diabetic, because he cannot live, he cannot survive more than that, he will die. So a type 1 diabetes will come very early to you, but a type 2 diabetes will come maybe 5 years, 10 years afterwards. The type 2 will be fat person. Then rapid death without treatment with insulin. If you find a person suffering from diabetes and he needs insulin, and he dies very rapidly without insulin, so you know that he had type 1 diabetes. But type 2 diabetes will not die without insulin so soon. Then a patient of type 1 diabetes will come to you without any complication. You find he has only diabetes. His heart, his kidney are all right. But if a person of type 2 diabetes comes to you and you diagnose him that he has type 2, you will have to investigate his heart, you have to investigate his kidney, because you may find there is nephropathy, there is problem in the heart, so they have more chance of complication. Then family history. You find in type 2 diabetes, there is positive family history. You will find that his father or mother or maybe brother, they might have diabetes. But usually in type 1, there is no family history. So these are the difference between type 1 and type 2 diabetes. So you can know who is type 1 and who is type 2. Now, this is the topics today we'll discuss. This is acute emergencies in diabetes. Acute emergency means this is emergency. Unless you treat him well, very soon the patient is going to die. So you see, that's why this is called medical emergencies from diabetes. So these are three. I think some people may find it little bit difficult because most of our homeopaths logic is little bit poor. If it is good, you will understand well. If you have little bit poor knowledge of physiology, I'll try to tell it easily. I hope you will at least grasp the main thing. So first, diabetic ketoacidosis. What is this? Diabetic ketoacidosis. You see, it's a major medical emergency. And very often, when I worked in allopathic hospital in emergency, almost every night we get one DKA. Diabetic people, they come to hospital with such complication, I'll tell you. It's a serious cause of morbidity. But this is particularly, this occurs with type 1 diabetes, not type 2. Diabetic ketoacidosis occurs in type 1 diabetes mellitus who did not take insulin for a long time. Say he's suffering from type 1 diabetes mellitus and he is not taking insulin for not long time he will die, maybe for a few weeks. And sure he will develop this diabetic ketoacidosis. Why? The cardinal features are he will have hyperglycemia, means his blood sugar will be very high. Then he will have hyperketonemia. One is called ketone bodies. This is breakdown product of fat. He will have high ketone bodies in the blood. And his blood will be acidic, mostly acidic, metabolic acidosis. These three features will say that he has diabetic ketoacidosis DKA. And this is very serious. The patient will die unless you treat him very well. So we find when he has hyperglycemia, if when his blood sugar is very high, he will develop polyuria. He will lose so much of urine with his uh, urination, and he will have dehydration and electrolyte loss. All his sodium and potassium will be going out through urine, and he will have hypokalemia. And hypokalemia will kill him by affecting his heart. So you see, this is very dangerous. Now, what symptom you will find? How you will suspect that this guy is having ketoacidosis? First thing he will say, oh, I have too much urine since, say, yesterday. I am going to bathroom after every, say, 15 minutes. Urine and urine. And at the same time, I have too much thirst. I'm very thirsty. I have nausea, vomiting. He will have leg cramp. Why? Because he will lose electrolytes. So there will be cramp in the calf muscle. Then his tongue will be very dry, cracked, and if you see his pulse, there will be tachycardia, his blood pressure will be low, he will have deep breathing, sighing, and there will be a sweet smell in his breath. Sweet smell. Why? Because it contains acetone, ketone. That's why there will be sweet smell in his breath. And you will find he will have mental apathy. He is apathetic. He does not understand anything what is going on around. He will have blurred vision. And ultimately he will be unconscious, comatose, and death. You see, it's very emergency and dangerous. It must be treated very soon, without delay. Now, here in this pen, I'll tell you one history. One of our homeopathic leader. He's a good leader. He was a good leader and good homeopath, classical homeopath. May God bless him with heaven because he died. He's no more. So he had diabetes mellitus. And one early morning, his wife called me. I never knew her, but she told that I know you. So you know my husband and he's severely ill. Can you please come? And that was about early morning, 6 to 7 o'clock, something like this. So I just dressed up. I told my wife that I'm going to see a friend. So I then and there I went to his house. I found there are 5, 6 of his deputies, homeopaths. They are sitting and they are reading the Materia Medica, and they are trying to give him Dalkamara. And that our homeopathic leader, he was doing convulsion like this. If you can see, he's doing convulsion, and his mouth is like spasmodic movement in his face. I knew that he had diabetes, and the picture I saw, then and then I diagnosed that yes, and I know that he's not taking anti-diabetic drug. He's taking homeopathic drug only. So I told his wife that your husband has an emergency condition, medical emergency, and if you ask my help, I want to take him to nearby hospital. Oh, then his deputies were very angry that, oh, man, you want to take our leader to allopathic hospital. Then I told you, I don't consider you as a doctor. He's going to die. And you are giving Dalkamara. Why you are giving Dalkamara? They said the other day he went outside in the evening and he was in the fog. And that's why he developed this. That's why, yes, we know. But Dalkamara will make him all right. So I told his wife that, you see, this is your husband. So if you tell me, I'll take action. I'll start what to do. But if you don't take me, I'll not do anything. She don't know. And his sons also, they told, no, we called you. You are the one to decide. So I called the ambulance, took him to the hospital. And I know some friends there. I told them already by telephone that I'm bringing a patient. And I think he's in diabetic ketoacidosis or hyperosmolar coma. Please take care. So then and there, they took him to the emergency. They gave him high dose of insulin. They started fluid. And within few hours, he was just all right. All right. We'll evaluate, also do more tests that you might have some complications, this and that. And then he thanked me also, this my homeopath friend. Then I came back. So this I told you why, you see. We should be scientific doctor. We should be not only homeopath, homeopathic chikishak, homeopathic physician. Otherwise, we will kill our patient. Patient's life will be not safe with us. So that homeopathic doctor, he died maybe 7 years afterwards, after this incident. He still lived 7 years. So he would have died that day. They were giving him Dalkamara. Anyway, so that's why I'm telling, that's why we are discussing these topics here. Diabetes, ketoacidosis. We should know, because this patient will face. And the patient life will be dangerous with you if you don't know this thing. At least you should know that this is an emergency case and his life is in danger and he should be sent to hospital. As we have no good homeopathic hospital, we'll have to send him to allopathic hospital for emergency purpose. Okay. So for decay, what we will do? So DKA patient needs hospitalization. It cannot be treated in your house. It should be treated in a hospital. And first 24 hours is very important to manage him. So that time they will give him short-acting insulin. He must be given insulin, otherwise he'll die. Then, because he lost so much fluid, 6 liters of fluid he lost, he will have to be given fluid, intravenous fluid. And he lost so much potassium. That's why he had cramps, and his heart will be in jeopardy due to hypokalemia. That's why he must be given potassium as well. With this thing, if you treat, you find that after within an hour or 2 hours, he is getting all right. And then you evaluate his case and give him full treatment. If you delay, what will happen? If you delay, you see, these 3 things will happen. That he was a good colleague of mine, that he would have developed cerebral edema. His brain will be edematous. And you understand what will happen if there is edema in the brain? Or he will develop acute respiratory distress syndrome. He will have respiratory failure. He will have cardiac failure, and he will die. It is so important. So just I mentioned here, we don't have chance to give homeopathic medicine. No. Because this is an emergency. And we know from Organon, Hahnemann allowed us that in emergency, yes, for the life of the patient, you can take this measure. And afterwards, okay, you treat him by homeopathy. Now, another one is called hyperosmolar diabetic coma. Hyperosmolar with type 2 diabetes mellitus. Here also mortality is very high. You see, 40% die. If the patient develops diabetic coma, his life has chance of 60%, 40% chance that he will die. So it is also so important. This is characterized by also severe hyperglycemia. His blood sugar will be very high. You will find, you see, 50 or 900 milligram. There should be 7 is the normal limit, and this guy will have 50 millimole. But he will have no ketone bodies. He will have severe dehydration and maybe even renal failure, acute renal failure. Now this one differs from ketoacidosis. Why? Because this is type 2 diabetes mellitus. So his need of insulin will be less. If the first one needed, say, 30 units insulin, this guy will need 15 units of insulin, less. And ketoacidosis will need more fluid, intravenous fluid, 6 liter. This one will need only less, maybe half that. But also this is emergency. And also this should be treated in hospital. In the house, no. If you find a guy, he was taking tablet, not insulin. This is type 2 diabetes mellitus. He was having tablets, and he is not taking tablet for, say, a long time. There are some people who gives up taking medicine without any reason. And suddenly he will develop this diabetic coma and he will die. So just to take care. Now third complication is hypoglycemia. Third complication. Also this is medical emergency, because the patient will die, or if he does not die, his brain will be out of order. Wow. So you see our hypoglycemia, when the blood glucose, normally it is, say, 5 to 7. But if it is less than 3.5, then this is called hypoglycemia. Less glucose in the blood, less than 3.5. Now how it can happen? This hypoglycemia, why it happens? It happens usually in type 1 diabetes mellitus who takes insulin. Say for example, insulin should be taken half an hour before your meal. When you will take lunch, you take the insulin half an hour before. Now some persons, say for example, I know some people, my relatives, they went to the prayer of Juma in the Friday, and they thought, because after coming back from Juma, he needs to go to dining table to take food. So how he will manage this half an hour? So just before going to Juma, he took insulin. Now after Juma, there was a lecture. There, maybe public lecture, or some people came from outside and they are giving some bayan, and he seated to hear it, and he forgot that he took insulin and he must take food now. And maybe 1 hour, 1.5 hours elapsed, then he will develop hypoglycemia, because this insulin is not finding any food. So he will make his blood sugar low and low, lower and lower, and it will be less than 3.5, and he will develop hypoglycemia. And this is dangerous also. His brain will be affected, because brain can tolerate only 5 minutes without this glucose. So if somebody takes insulin, and he must take food within half an hour. If he does not take it, he will develop this hypoglycemia. So how you know what is the symptoms? You will find he will be sweating. There will be sweating, perspiration, trembling. He will be trembling. He will have nausea. He will have headache, anxiety, confusion, incoordination, behavior change, speech difficulty, drowsiness. So if you find some patient like this, then and then you will have to treat. How to treat? You see, treatment is very easy, because this guy needs food. This guy needs glucose, because he has taken insulin and he does not take any food. That's why if it is very severe, you'll have to give him glucose, concentrated glucose, 25% dextrose, 25 ml or 50 ml IV, then and there. And when you will find that he is getting a little bit better, then give him food by mouth, sugar, sharbat, even Pepsi, even anything, any juice, you give him by food, by mouth, so that he can increase the blood level of his sugar. Otherwise, he will die. He will have, he will develop cerebral edema in delaying of treatment, and it is associated with high mortality. So also this one you must keep in mind. If a person is having type 1 diabetes mellitus, taking insulin, he must have some biscuit in his pocket always, some biscuit, some chocolate, or some sugar bar. But when he finds he has hypoglycemia, he must eat it then and there. Now also I give you another story. I took the training of meditation. I took Silva meditation, both graduation and pro master, and also this quantum meditation. So after graduation, 4 years after graduation, I took this is called pro master meditation, and then they take this group of people for pro master to hill treks, Chittagong hill treks, Lama. In Lama, there is a big center. There you'll have to stay there for 4 days, and the rule is there: 3 days, first 3 days, you cannot talk, no sound at all. You will have to communicate by finger, by gesture only. Only in masjid, who will give azan, this muazzin, and who will lead the prayer, imam, they can speak, means they can utter the surah and like this. So alhamdulillah, they said, who will pray, who will lead the prayer? I said, yes, I am the one, if you allow me. So I was the imam 3 days there. Alhamdulillah. The first day only, suddenly I found there is shouting. And what happened? So there, their food is only 2 times. One meal in the morning, another meal in the evening. In the evening means before sunset. And there is no other meal. You cannot take any food. Only you can take water. So there was one patient of diabetes mellitus type 1 and one lady. She took insulin. Now, food they said they will give 6 o'clock in the evening. But she took it earlier. And she did not have any other food. Then she got unconscious. And people were not talking in terms of words. They were just shouting. Oh, like this. Then somebody told, oh, you are a doctor, please go there. Maybe there is some problem. Then I got, okay. Then I ran there. Then I broke my silence. I told, oh, you must talk. What happened? Tell me. Nobody talks by gesture. I told, I don't understand gesture. Talk. This is an emergency. This guy is dying. Then one told that she's a diabetic patient. Then I understood. Because I'm a doctor, for a long time, I understood. I told her, she took an insulin. She told yes. So I know the thing. So I told them, please bring some sugar or molasses or anything sweet. So they brought some sugar, some fluid, and I told her, because there is no saline, no glucose saline. So I told her to take this sugar more and more. And maybe after, say, half an hour, she was all right. So you see, because I know it, that's why she was saved. Otherwise, she would have hypoglycemia and maybe brain damage. So just by story, I give you the example. So this is hypoglycemia. Now we come to long-term complication of diabetes. It's a very, very important topic. Just please you hear it very attentively. This is very, very important. If a person has diabetes for a long time, 10 years, 15 years, 20 years, then what complication he might have? So these complications are divided or classified into 2 groups. One is called microvascular complication. Another is called macrovascular complication. What is this? Microvascular means small vessels, small arteries. Complication occurs in the small arteries. And macrovascular means complication occurs in the big arteries. So what are the small arteries? Where? In the eyes. A person having diabetes mellitus for a long time and maybe not well treated, he will have diabetic retinopathy. His retina will be damaged and he will be blind. There will be intraocular hemorrhage. There will be retinitis, then retinal hemorrhage, and he might have cataract also. So these are the things will occur if a person having diabetes and he is not taking good care. This in the eye. Now you come to kidneys. You find most of the patient who has diabetes mellitus, they have kidney problem. They have diabetic nephropathy. They have CKD, chronic kidney disease. This is 5 phase kidney disease, CKD 1, 2, 3, 4, 5. When you are in 5, you will have to go for dialysis. So if a person having diabetes mellitus and not well controlled, is disregarding treatment or diet and this and that, then he is going to have damaged kidney. Then nerve. There will be peripheral neuropathy. This person will say, I don't have any sense in my hands and foot. There is burning sensation and I have motor weakness. I cannot walk well. I have less energy in my foot. Or he may have postural hypotension. He will fall down. This is due to peripheral neuropathy. And he may have foot disease. You will find many diabetic patients uncontrolled. They have big ulceration in the foot. There is gangrene in the foot. So these are all microvascular complications of diabetes mellitus. Then we come macrovascular complication. The complication what occurs in big vessels. The first one is coronary circulation in our heart. We told in the other lectures, there are 3 coronary arteries in our heart. And by diabetes mellitus uncontrolled, there will be much atherosclerosis or lipid deposition in his coronary vessels, and he will have myocardial infarction. He will have blocked 2 vessels, 3 vessels, and he will develop myocardial ischemia, myocardial attack, and patient may die. Or he may have, if he's lucky, you take him to the hospital, they will manage him maybe by stenting or by medical management. So myocardial infarction is very common in diabetic patient. And you know the thing, this is called silent myocardial ischemia. The diabetic patient will have no pain. This is very dangerous, If you have myocardial infarction and if you feel the pain, then you are calling people, oh, come, I'm having pain, take me to hospital. But this poor guy, diabetic patient, he will not have pain. The heart is going to be damaged like anything when he is not knowing it. So patient will die without asking any help. You find a patient of diabetes mellitus, he died in the room, nobody knows. In the morning they go, he does not open the door. They broke the door and find he died. Most common possibility is he died of myocardial infarction, silent myocardial infarction. You see how dangerous it is. Then, like heart, this will affect our brain. There will be stroke. Their cerebral vessels will also have atherosclerosis, and the vessels will be blocked. This may rupture cerebral hemorrhage, or this may block cerebral thrombosis, and he will have stroke, hemiplegic, paralysis of half sight, or he may die even. This is due to macrovascular complication of diabetes mellitus. Or the patient may have peripheral circulation block, and there may be ischemia and gangrene. Just I give you some photographs so that you know it. This is diabetic retinopathy. This is a normal retina. You see, clean cut retina. And you see here, this is hemorrhage, retinal hemorrhage, retinal blood vessels are, you see, swollen. And if there is big hemorrhage, the patient will be blind. He will not see. This is called diabetic retinopathy, or his retina may be detached and he will be blind. So this is diabetic retinopathy. Now this is diabetic neuropathy. I told you there will be numbness, there will be tingling sensation, you will not have any sense like this. This is called diabetic neuropathy. You see, neuropathy. So you see, diabetic foot. You see what happens. Diabetic patient has more chance of infection. If there is an infection in diabetic patient, it does not heal very soon. Why? Because particularly in foot, the circulation in the foot is very poor. From heart, there is a long distance up to foot. So blood goes less and less, and least to the foot. So if there is an ulcer, if there is a crack, if there is a cut, this will not heal very soon. Rather, this will ulcerate and make a big ulcer. You see, there is hole inside the foot. So I don't have chance here to ask you what is the medicine you can, what is the symptom of what medicine? This one. This is a clean cut, you see, clean cut ulcer, clean cut ulcer, and very deep, and also there is no discharge. This is like calibacrom ulcer. And you see, this is a clean cut, and you see this one. This is gangrene. Gangrene, you will find many diabetic patients while he was cutting his nail here, he made a small injury, and this injury became ulcerous, then gangrenous, then he will have to lose all his foot. The surgeon will cut his foot to save his other part of the body. So these are all long-term complication of diabetes mellitus. Also, you see, very dangerous thing. A diabetic patient, unless he is very cautious about his condition, he will develop diabetic nephropathy. I told you how diabetic nephropathy occurs. You see, this is a nephron, this is glomerulus. So usually there is, you see the picture here, there is all the protein remains in the blood because this kidney filters our blood and makes urine. And in filtration, all protein returned back to the blood. It does not go to the urine. No protein will go to the urine in a normal kidney. But when the kidney is damaged by diabetes, by diabetic nephropathy, there will be big hole in the glomerulus, big hole, and protein will go out from the blood. You see, protein is going out from the blood. So if you have chronic loss of protein from your blood, you will have hypoproteinemia. Hypoproteinemia. And this will cause edema in your body, edema in your body. And ultimately, if it goes on without treatment, he will develop full-fledged diabetic nephropathy and diabetic kidney failure. So this is very unfortunate thing for a diabetes patient who does not take care. Oh, you see myocardial infarction, I told you. The rate of myocardial infarction in diabetic patient is much more than the normal people. So I am telling who has diabetes, don't be afraid. Diabetes is a treatable disease, manageable disease, only if you are cautious and if you are serious. If you just don't take care, you say, okay, no need, then you are going to lose so many things. Otherwise, no problem. You can lead almost a normal life. This is brain stroke. As I told you, like our heart, also these vessels, cerebral vessels, they have atherosclerosis, and there will be narrowing of the artery, and no blood will go to the brain here, you see, and there is cell death of brain damage due to cerebral thrombosis or cerebral hemorrhage, and this person will have brain stroke, and he will have hemiplegia, or he may die if it is very widespread, all due to diabetes mellitus. So let us come. The long-term result of treatment of diabetes are disappointing in many patients. Complications occur even when taking regular treatment. You see the thing. If a person is taking good care of his diabetes, even then, diabetes does not spare him totally. He will bite him little and little. Still there will be complication, but maybe this is delayed. And if you have diabetes and you do not take care, what will happen? So you will have all these complications, as I said. And our friend, our colleague, good homeopathic doctor, he died in early age. Why? Because of this diabetes mellitus and its complication. You see, very sad. The excess mortality incurred by diabetic patient mainly caused by macrovascular disease. This, I tell you, the diabetic death occurs mainly due to macrovascular disease, not micro. Macrovascular disease, what? This heart attack, this brain stroke. Most of the patient dies from this. But microvascular disease like diabetic nephropathy, patient will die, but it will take long time. You live maybe 5 years, 10 years, 15 years, then he will die. But if he has severe myocardial infarction, severe stroke, he may die then and there, or maybe after a few days only. So here, I show you the causes of death in people with diabetes mellitus. The death of diabetes people, 70% from cardiovascular disease, you see. Cardiovascular disease in heart and brain stroke. These two together, 70% death occurs from the cardiovascular disease. 10% occurs from renal failure, kidney failure. 10% from cancer. 6% from infection, 1% from diabetic ketoacidosis, and 3% from others. Now, what to do to prevent these complications? What we can do so that I may have diabetes, but I will avoid the complications. So we'll have to do two things by any means. By homeopathy, by any pathy, you will have to achieve these two. What is called glycemic control means your blood sugar level must be in an optimum level. Your blood sugar should be kept normal, within normal level. Second thing, there are some risk factors of diabetes mellitus like lipidemia. Diabetic patient has a high cholesterol level, high triglyceride level, and they does atherosclerosis, causing this heart attack and brain attack. And they also have off and on high blood pressure. So you will have to keep his blood pressure and lipid level normal by any means. By what treatment, but it needs these two things. His diabetic, his blood sugar level should be within normal, and this risk factor like blood lipid and blood pressure should be within normal. If you can keep these two, this patient will be having no complication or very little complications. Now, let us come how to manage diabetes mellitus. How to manage diabetes mellitus. I give you, this is the conventional protocol of diabetic management. Also, you should know it. Why? Because many patients come to us from allopathic side. So we should know what he is taking and what they have done for him and with what he has come to me. He came to me with renal failure, or he has block in the heart, 2 stenting or 3 stenting, or he had one attack, hemiplegia. So I should know with what he came to me and what treatment he has taken in the allopathic hand. That's why we should know the normal or conventional protocol to manage diabetes. So there are 3 protocols of treatment of diabetes mellitus. You see, the good thing is that 50% of the patient you can manage only by diet control and lifestyle management. Diet control and lifestyle. 50% patient will be all right, because not all of them have very high diabetes, maybe moderate. So if you tell him, give him a good diet chart, or if you don't know it, send him to a nutritionist. They will make a diet chart for him. And lifestyle advice, that how much he will do the exercise, will tell you afterwards. And his lifestyle, he will have to leave smoking or alcohol or this and that. Then 50% cases of diabetes will remain normal. You see, this is a good thing. Then 20 to 30% of patient will have to have insulin. You cannot do anything here, because he is insulin dependent diabetes mellitus, maybe type 1. A 14-year boy having diabetes mellitus, you cannot cure him. Why? Because we told you in the first lecture, because there are islets of Langerhans in our pancreas. So if 60 to 70% of the islets of Langerhans already damaged by viral infection or by something, autoimmune disease, only 30% remains, then he will have absolute deficiency of insulin, and he will have type 1 diabetes mellitus. So he will need insulin replacement therapy. You cannot give him any treatment to regenerate his islets of Langerhans, and it will secrete more insulin and you will cure him. No. If it is type 1 diabetes mellitus, as in a boy of 14, 15 years, he will need the insulin, otherwise he will die. So also here, we have very little to do. Also here, you see, 50% good. So we have problem with this 20 to 30%. Here, we homeopath, we can help the patient too much. who takes tablet. This is called oral anti-diabetic drugs. If you find a patient having diabetes taking tablets and he does not have any more complications, then this is a good case for homeopathic doctor. But if he comes, he was on tablet, maybe a patient of 65 years like me, he was taking tablet for 15 years. Now since 1 year, he is taking insulin. What does it mean? It means he was diabetic type 2, now he is converted into type 1. Means his insulin reserve has gone. And this patient having diabetic nephropathy or has heart attack. This case is a bad case for you. You have very little to do for him. Yes, you can do something for him, but little. So you will have to choose the case and treat him accordingly. Some patient you can treat to cure. Some patient you treat to help. So about 50% of new case of diabetes can be controlled adequately by diet and exercise alone. You see, only by diet and exercise. 20 to 30% will need an oral antibiotic drug, the tablet, and other 20 to 30% need oral insulin injection. So the type of treatment is determined by the adequacy of residual beta cell function. So you have to know how much beta cell insulin producing cells in the islets of Langerhans still remains in the pancreas. If it is enough, you can cure him. If it is less than, the damage is more than 70%, then you cannot cure him, because you cannot regenerate the islets of Langerhans. Then he will have to need insulin to his life. So you have to choose the case. What case came to you? Now lifestyle management. We say diabetic patients, they should follow lifestyle management. This means regular exercise, a healthy diet, and reducing salt intake, alcohol, and giving up smoking. This is lifestyle management. Now we'll see how much food he needs. Particularly a patient for diabetic mellitus type 2. They are usually overweight, obese patient. And they have more cardiovascular risk. And they have more insulin resistance. This type 2 patient, they have enough insulin in the body, but still he is diabetic. Why? Because this insulin cannot work. There is resistance developed against insulin. So we homeopath can treat in this point. If we can reduce by homeopathic treatment, by his constitutional treatment, we can reduce this resistance to insulin because he has enough insulin. Only if we can remove this resistance, then this insulin can keep him in normal health without taking any drug. So this weight loss, how can you achieve this weight loss, weight management? You tell the patient to take only 1/3 of normal, to reduce by 1/3 of normal diet. In normal diet, we take 2100 kilocalorie. So he will have to take 1400 kilocalorie, 700 less. You tell him if you took 3 breads at night, now you take only 2 breads. You took 3 cups of rice in the lunch, you take now 2. It means he'll have to cut his food by 1/3, number 1. Number 2, he will have to make regular exercise. He may do walking in the park, jogging or swimming or cycling. How long? Must be at least 40 minutes daily for 5 days. This is medical exercise. So some woman says, I have patient, they said, oh, I always walk in my house from kitchen to this room, kitchen to that room, here, there, and doing washing of clothes. So I do exercise. I don't know. This is not exercise. This will not help you controlling diabetes mellitus. So what is the criteria of medical exercise. This you will do 40 minutes exercise means either two things. Either you will have to sweat, there will be perspiration after this 40 minutes, or your pulse should be 50% more than the beginning of in the exercise. In the beginning of the exercise, if it was 80 per minute, at the end of the exercise, it must be more than 120. This is called medical exercise. Then yes, you did exercise. So this sort of exercise, every day 40 minutes for 5 days. You can take 2 days rest. So this is not very tough. I do every day, more than this. So I hope all our brothers, we can continue this exercise, 40 minutes daily for 5 days. And how much exercise? You'll have to sweat, or your pulse rate should be 50% more than in the beginning. You can count the pulse before you start your exercise. If it is 70, it should be 105 at the end of your exercise. It is like this. Now your diet, you will have to take, we have 3 types of diet, carbohydrate, fat and protein. Your diet will contain, say, half by carbohydrate, 45 to 60%. 35% will be, less than 35% will be fat, and 10 to 15% will be protein. It is better who has diabetes mellitus and control, he should go to a nutritionist, and they will make him a diet chart, how much he will take in the morning, in the lunch, at night, and in between, and he can follow it. Or we homeopath, we have knowledge of nutrition, we can give also, but that would be better if from a nutritionist. Well, okay, just I tell you, the patient of diabetes, they take tablet. What this tablet does? What is the action of this tablet? What it does? It does 3 things. This tablet go and stimulate the pancreas to secrete more insulin, because this tablet is taken by type 2 diabetes mellitus patient, type 2 diabetes mellitus, not by type 1. Type 1 diabetes mellitus will not take tablet, he will take only insulin. So they give this tablet, this will stimulate insulin to secrete more insulin. This will stimulate pancreas to secrete more insulin, number 1. Number 2, they will reduce the resistance to insulin. They will increase insulin sensitivity, and they will increase peripheral glucose uptake. By this way, they control the blood sugar level in the blood. But this, those who are taking this one, their main factor is they have much resistance to action of the insulin. So this is the factor which causes type 2 diabetes mellitus and the whole problem. For insulin, insulins are 3 types. One is called short-acting insulin, another is intermediate-acting insulin, another is long-acting insulin. And this insulin is injected subcutaneously, not in the muscle, subcutaneously, just below skin, mostly in the anterior abdominal wall, maybe here, maybe in the thigh. But how they make the dosing of insulin? Usually those who take insulin, they are given a portion short-acting insulin and a portion intermediate-acting insulin. Say if a person is diagnosed to have type 1 diabetes mellitus, and they calculated that he should have 30 units of insulin daily, 30 units of insulin daily. So they will give 10 units short-acting insulin and 20 units intermediate-acting insulin. And out of these 30 units, they will give 2/3 in the morning and 2/3 in the evening. This is the insulin regime. So they will give 1/3 short-acting insulin, 2/3 intermediate insulin. And out of these 30 units, 2/3 means 20 units they will give in the morning, because in the morning, in morning and lunch they will take more food. And at night they give 1/3 only. Why? Because night they will take less food. That is the thing. Now, this scientific people, they are now advancing insulin management more and more. Why? How? You see, they are giving inhalation insulin. Now it is being developed. No need of injection. You will inhale. Like you see, this bronchial asthma patient, they take inhalation and they get better. So they will take inhalation of insulin without injection. Sometimes they do transplantation of isolated pancreatic islets. They will take pancreatic islets from another person and they will operate and transplant it in the body of the patient. So he will have islets of Langerhans and this will secrete insulin and he will be free of diabetes mellitus. So they are doing many research on that way. So we are not very much interested to give more time for this. Let us go to homeopathic management. I think I can take some more time and today I will finish it. Dr. Anwar, I think I can finish it today if you give me time up to 11 o'clock. Can I? Anybody hearing me? Okay. Okay. So, what is our homeopathic approach to this big problem of diabetes mellitus? You see, number one, we say diabetic type 1, where most of the pancreatic islets of Langerhans are destroyed, is not amenable to cure by any medicine. It needs replacement therapy with insulin. If we have a type 1 diabetes mellitus, like as I said, in a boy of 14 years, 12 years, 10 years, 15 years, it means his islets of Langerhans in the pancreas are destroyed, more than 70%. And he does not have enough insulin. So he needs insulin to survive. So here we have only very little to do in this case. Okay. Second thing, we can help type 2 diabetes mellitus patient. We can help them. When found early and before any long-term complications. If a type 2 diabetes mellitus comes to us early, before any long-term complication occurs in his kidney or heart or brain or here and there, then this case you can treat by homeopathy to reduce his, as I said, resistance to insulin. His tissue became resistant to insulin. That's why there is insulin, but insulin cannot act. So this would be our approach, that we can select type 2 diabetes mellitus early and before any long-term complication, and we can treat him. This is ideal for homeopathic treatment. But the first one is not ideal for homeopathic treatment. It is difficult. And we have only little to do here. So how you do homeopathic treatment? This may be achieved only by careful, long-term homeopathic treatment based on individualistic, constitution, and miasmatic consideration. There is no fixed drug for diabetes mellitus. You will have to consider the diabetes mellitus as a chronic disease. We will say the miasmatic consideration and treat him as Hahnemann said in the organon, how to treat a chronic disease. There is no fixed treatment. Now we come, homeopathic management may be as follows. Number one, we will give the patient same lifestyle management as in conventional medicine. About his food, about his exercise, about his habits. We will give him same advice as in conventional medicine, number one. Number two, diet and exercise. Same as in conventional medicine. There is no diet and exercise for homeopathy. This is same. And third one is by homeopathic remedies. And that is by constitutional, individualistic, chronic miasmatic approach. Now, the good thing is for us, what more challenging diabetic patients for homeopathic physician is only 20 to 30% patients who need oral antibiotic. We said a portion of patients, this is 20 to 30% only. They take an oral antibiotic tablet, and they develop diabetes due to resistance to insulin, tissue resistance towards insulin. So this is the challenging case for us where we can do something for this patient. But 50% of new cases of diabetes can be controlled by diet and exercise alone. We said before, 50% case you can manage as like other diabetician, diabetician, same advice and follow up. And we know 20 to 30% will need insulin. Also, we have little to do here. We need to act very seriously for these 20 to 30% patients who need oral anti-diabetic drug and who are type 2 diabetic patients. Now, I give you here some hints how we can approach to select homeopathic medicine. As I said, we'll have to take his history. First, you'll have to sort or you have to select the patient. You cannot take all patients for homeopathic treatment. If it is a boy of 10 having diabetes, type 1 diabetes mellitus, it is not an ideal case for homeopathic treatment because it does not have any insulin in the body. But for type 2 diabetes mellitus, taking tablets and no long-term complication, yes, we can accept it. So we will take the history as from organon, Hahnemann said, from aphorism 82 or to up to 103 or 104. That way we will take his history as a chronic case. And then we'll sort out his symptoms, peculiar symptoms, following 153 aphorism. Then also we'll have to recognize the dominance of the myxome in the body, because we know diabetic mellitus mostly they say it is tubercular myxome. It is tubercular myxome, Khoy rog. There is only deletion from the body, sugar and sugar. His body will be dried and dried, emaciated and emaciated, and he will lose his organ and he will die. This is syphilis. So Sora and syphilis makes tuberculosis. So they say it is tubercular type of patient, you saw. Or you may have, there is syphilis more, there is gangrene and there is damage of kidney failure. There may be syphilitic component more, or there may be soric component more instead of tuberculosis. So according to the dominance of myxome, in the case, you treat him either with antisoric or anti-tubercular or antisyphilitic or antipsychotic. This is easy to say, but not so easy to do the treatment. So one must be very, very knowledgeable physician to treat such case with a challenge. So we can take some help from the repertory. You find in the repertory there is general chapter, diabetes mellitus, there are so many medicines. Natrum sulf, lyco, natramure, lactic acid, pencatinum, phosphoric acid, phosphorus, plum balm, Syzygium tarantula, uranium nitrate, but this will not help you to select the medicine. Just this gives an idea that there are many medicines having symptoms of diabetes. Then we find general emaciation, appetite with emaciation. The patient has enough appetite and he takes much food, but still she goes on emaciating. Then diabetes mellitus accompanied by gangrene. As you saw, the patient has gangrene in the food. So there are so many medicines covering this one. The patient has sugar in the urine. You see there are so many medicines. Helonius, lycopodium, phosphoric acid, phosphorus, plum balm, Syzygium, tarantula, terebinthine, uranium nitrate, like this. Then I am giving it just to show you that we have medicines having diabetic symptoms. And stomach, thirst extreme. Diabetic patient has extreme thirst because he loses much urine. So there are so many medicines to cover this symptom. Then stomach, appetite increased. Diabetic patient has increased appetite but still emaciating. So there are so many medicines. Then bladder, urination, frequent urination. They have frequency of urination. So also so many medicines. Then they have extremities, gangrene, diabetic gangrene. You see the medicines, diabetic gangrene of foot. There are so many medicines. Now, I give you some because we cannot discuss it for very, very long time. That's why I give you a list here, only suggestive list. This is not at all exhaustive, only to give some ideas. Say, when we treat diabetes patient, this medicines comes more because they have more symptoms of diabetes mellitus. Acetic acid, acid phos, helonius, lactic acid, lycopodium, natrum sulf, natramur, pancreaticum, nowadays another one, insulinum, phosphorus, plumbum metallicum, sulfur, caesium, uranium nitrate. So these are only suggestive. Any medicine can come from your history as detailed and directed by Honeyman in the organon. We'll have to take that line only. Now, there are some medicine, I think we have not much time. I gave you some just as a hint. Acetic acid, acid phos, lycopodium. Just I discuss one medicine and finish. Acetic acid. You find many symptoms of diabetes mellitus in acetic acid. You find its thirst, intense thirst, burning thirst, insatiable even for large quantities. It takes too much water, like diabetes patient. And there is chronic diarrhea, but there is a peculiarity. He has no thirst in fever. If that patient has any fever, no thirst. So this is aphorism 153. This is a peculiar symptom. He will have great burning thirst, insatiable even for large quantities. It takes too much water, but no thirst in fever. And his urine is, you find, copious pale urine. His urine will be pale. It is not thick or it is not concentrated. It's characteristic of acetic acid. Especially if accompanied by intense burning thirst. If you find a patient having too much urine, pale urine, and has too much burning thirst, and his skin is dry hot because he is losing too much urine and he is so much weak. So there is a picture of acetic acid. And acetic acid also has dropsy. You see, he is losing too much water, again he has dropsy. Dropsy means edema. And if you find dropsy with great thirst, like aphocyanum, dropsy with great thirst, debility, and emaciation. Acetic acid patient is always emaciated, and diabetic patient also emaciated. Diabetic patient has too much urine, too much thirst, so also acetic acid. So you cannot expect that all your patient will follow this one. If it follows, just I am giving you some example that our medicine has picture of diabetes mellitus, so it can cure. Why not? If it is curable. One of the prominent medicine for dropsy associated with diabetes is acetic acid. Dropsy associated with diabetes. And he has diarrhea, copious diarrhea, exhausting diarrhea, great thirst, dropsy. Then he has night sweats, chronic diarrhea of emaciated children. He has sour belching. He has gastrointestinal problem also. He has sour belching, eructation and vomiting after any kind of food. Burning water breath, profuse salivation day and night. He has profuse salivation day and night, and he will vomit and belching after any kind of food. He will have great prostration after any injury. He will have great emaciation, especially of the face, hands, and thighs. You find this patient, diabetic patient also same. Diabetic takes much food, but he emaciates. And acetic acid has emaciation of face more, hands and thighs. Marasmus and other wasting disease of children. pale, lean person with less muscle fibers, with profound anemia and waxy pallor of the face. So you see, these are diabetic patients' symptoms. And there is also hemorrhage from every mucous outlet. He has much hemorrhage, epistaxis, and if a female, she will have metrorrhagia. And another peculiar symptom of acetic acid, he cannot sleep lying on back. On the back, he sleeps better on the back. So there is one medicine is ARS, and if you say he sleeps better on back with stretching of the hand like this, it becomes Suriname. And this patient, because they cannot lie on back, he rests better lying on belly, like tuberculinum, like medorinum. This patient, and mentally this patient are irritable. They borrow trouble. If irritable patient like CPI patient, worried about business affairs, like bryonia patient, they always worry about their business, and they grieves about his sickness and children. He thinks much about his sickness and children. So this is only a small picture of a medicine having diabetes picture. So you may find so many medicine like this. You see acid force, you can find like podium, you can find so other medicines. So I am not giving you the great details, just I am giving you the hints that for diabetes patient, my last question is that out of 100 patient, 50% patient you can treat by adequate diet and exercise, and you can give him homeopathic medicine so that he does not develop over diabetes. This is a good case for us. Then 20 to 30% case not for us. This is type 1 diabetes mellitus, insulin dependent. We can help only little, but we can help a substantial help to the patients of type 2 diabetes mellitus who takes tablet, and when he comes early before developing any long-term complication of vital organs. These are the cases we can choose, and if you have good knowledge on your materia medica, good knowledge of how to take the symptoms, and good knowledge of repertorization, I believe you can find good homeopathic remedies for this patient. Of course, by one medicine, you cannot cure or treat a case. It takes a series of medicine, but you can help this patient better than allopathy. With this, I am finishing my lecture here. Thank you very much for your patient listening, and I hope who attended our lecture, they have a little bit knowledge of diabetic mellitus, its conventional side and as well as its homeopathic side, and it may help them in their practice as well. In the next week, I'll give the same lecture by 2 weeks, maybe it will need 2 weeks, by Bengali. So who understood or followed a bit less in this English version, you can attend our Bengali lecture, or even all you can attend our Bengali lecture, you can enjoy in our own language. Thank you very much. Assalamu alaikum wa rahmatullah wa ma tawfiq illa billah. And now the platform is open for question and answer, and I hope Dr. Anwar Patari will take up the session. Thank you very much. Oh, there is some disturbance. There is some noise. I don't know who's. Dr. Anwar Patwari, there is some noise. Dr. Anwar Patwari, I hope you are listening to me.
Hello. Can you hear me, sir?
Yes,
Hello.
yes. You
Sir,
can take the session. Yeah, yes, I can hear you.
থ্যাংক ইউ ভেরি মাচ স্যার ফর ইউর ওয়ান্ডারফুল ডিসকাশন। এখন যদি কেউ কোনো প্রশ্ন করতে চান, আপনি আপনার নিজস্ব ভাষায় অর্থাৎ বাংলায় আপনি আপনার প্রশ্ন করতে পারেন, অথবা ইংলিশেও কন্টিনিউ করতে পারেন। কারো কোনো প্রশ্ন থাকলে হ্যান্ড রাইজ করে প্রশ্ন করতে পারেন আজকের আলোচনার উপরে। জি, আপনি আপনার মাইক আনমিউট করে প্রশ্ন করুন। হ্যান্ড রাইজ করেছেন ডক্টর পীযূষ, যে আপনার প্রশ্ন করুন, মাইকটি আনমিউট করে প্রশ্ন করুন।
স্যার আদাব।
আদাব আদাব।
স্যার যদি আমাদের কাছে কোনো রোগী ডায়াবেটিক রোগ আছে, এমন কোন রোগী যদি অন্য রোগ নিয়ে আসে, তাহলে এবং সে নিয়মিত ডায়াবেটিকের ঔষধটা সেবন করে, তাহলে আমরা কি তার ওই যে ডায়াবেটিকের ঔষধটা বন্ধ করে আমরা আমাদের হোমিওপ্যাথিক ঔষধ দেবো, না তার ঔষধটা চালিয়ে আমরা সাথে হোমিওপ্যাথিক ঔষধ দেবো? এটা জানতে চাই।
It's a very good question. He said, if a patient come to us with other complaints to treat, but he has diabetes and he's taking diabetic tablets or maybe insulin, in that case, what we should do? The thing is that if he came to you for skin problem, eczema, but he said that I have also diabetes and I am taking insulin. What I believe, if the patient is taking insulin and if he is type 1 diabetes mellitus or type 2 converted to type 1, in that case you cannot stop insulin. Then he will have much big complication, as I said, emergencies. So you'll have to treat him with your medicine with insulin going on. But if he comes with type 2 diabetes mellitus, so you can evaluate his condition. If it is an early case and if he has no long-term complication of vital organs, so you can give him the offer that I can treat your diabetes as well along with your present complaint. Then treat him accordingly, as I said. But if you find it's a complicated case, he has renal nephropathy, diabetic nephropathy, and he has come to you for other thing, and his diabetes nephropathy is a type 2 phase 2 or phase 3. In that case, it is difficult to cure his diabetes mellitus with his complications. So there are, I give you from reference of big homeopaths like father of Dr. Rajan Shankaran, his Pichi Shankaran, P. Shankaran. He said, I keep the treatment of diabetes of the patient as it is, and I give homeopathic treatment because I don't take the risk to aggravate his condition of diabetic nephropathy or other things. But in that case, he said, maybe your homeopathic medicine will act little bit less than you expect, but you have no other choice. So this is the answer. Thank you. Any other question?
ধন্যবাদ স্যার।
ডক্টর জাহাঙ্গীর আলম, মাইক আনমিউট করেছিলেন, আপনি আপনার প্রশ্নটি করুন। জি
sir, I am a newcomer. I am enjoying your valuable lecture. Sir, how can I get the lecture sheet if I go through your lecture sheet?
Okay, this lecture is here only in the lecture. They make, I think a record of this lecture. It is available in our Facebook page. You can collect the whole lecture and you find everything. Our PowerPoint presentation as well as my discussion. So
Now,
this is
if
the
I
way.
want to print your lecture sheet.
No,
How?
this is not that. This how can I give you? This is mine. You can make your own. You can make your own.
I can just here and write down taking
No.
notes and
You can take note or you can take whole lecture, and in the lecture you find all the slides here. So you can copy from here. You can
okay, I
read from.
understand.
Okay.
Okay,
Thank
sir,
you. Thank you.
আসলে এটা লেকচার শিট আমাদের ওইভাবে রেডি করা হয় না স্যার। নিজে প্রেজেন্টেশনটা তৈরি করেন এবং প্রতি সপ্তাহের আলোচনায় উনি নতুন কিছু ইনক্লুড করেন সেখানে। আর প্রত্যেকটা আলোচনায় আমাদের ফেসবুক পেজ বাংলাদেশ হোমিওপ্যাথিক পরিষদ বাংলা ইংরেজি অবলিক দিয়ে লেখা আছে, ওখানে সবগুলোই ফেসবুকে পাবেন। আপনি ওখানে সার্চ করলে আমাদের সবগুলো লেকচারই পাবেন। ধন্যবাদ। আর কারো কোনো প্রশ্ন থাকলে করতে পারেন।
জি, আসসালামু আলাইকুম স্যার।
ওয়ালাইকুম আসসালাম
জি
রহমতুল্লাহ।
জি স্যার, কেউ যদি দীর্ঘদিন ইনসুলিন নিতে থাকে, এই ইনসুলিন জনিত যে ব্যাড ইফেক্ট, এটা হোমিওপ্যাথি দিয়ে বা অন্য কিভাবে ট্রিটমেন্ট করব? ইনসুলিন জনিত যে সমস্যাগুলি হয় দীর্ঘদিন ইনসুলিন নেওয়ার ফলে।
Yes, for example, what complication you say? What are the complications of insulin? What you found?
ওই
আপনি আপনি কি কমপ্লিকেশন দেখেছেন ইনসুলিন নেওয়ার পরে একটু বলুন।
ইনসুলিন নেওয়ার পরে স্যার, যেমন যে জায়গাগুলোতে ইনসুলিন নেয় সেই জায়গাগুলি অনেক রাফ হয়ে ওই মানে পেটের চামড়াগুলি বা অন্য চামড়াগুলিতে এক ধরনের তৈরি হয়। এটা একটা মানে
Okay.
ইনসুলিন নিতে জি
Let me answer you. Yeah. You see, up to 1980, insulin was made from bulls and pigs pancreas. You know, cow pancreas and pigs pancreas. From that, the insulin company used to extract the insulin. That time, there was some complication occurring in the patient if he takes insulin for a long time, because this is an antigen, bovine antigen, and this is to make some problem. But nowadays, insulin is produced. It is called recombinant insulin production. They change by genetic engineering, they change the gene of some bacteria. And this bacteria in the media produce lots of insulin in insulin. And this is human insulin. This is human, it's the same insulin of human. So now it is much improved. But still I am telling you, as you said, if a person is having type 1 diabetes mellitus and he has no other way to avoid this insulin, so he will have to take insulin even if he has some little complication. In the skin, yes, of course, in the skin he may have some problem. He may have, it is called lipolysis. You did not say me, this is called lipolysis. Maybe that may happen. But this is inevitable. You will have to take this small complication for his big gain. So you have no other option. Thank you.
ধন্যবাদ স্যার।
হ্যালো, আসসালামু আলাইকুম। আসসালামু আলাইকুম।
Yes, Dr. Rakibuddin.
Assalamu alaikum. Excellent lecture is given. My question is, for diabetes patient, there are a lot of complications may be associated with like cardiac problem as well as high blood pressure. So in that case, any patient if does come to us, actually how to treat regarding this that is diabetes, very much complicated for a long time if the patient suffers. In that way, the cardiac problem as well as the high pressure is associated. In that case, how to actually deal as a homeopath like that?
As I told you, that we'll have to choose our case for cure. Even cancer case, even cancer cases, many cases come to our homeopathic doctors. And what I believe, we'll have to choose these cancer cases even. We'll have to sort. There's some case to treat curatively, some case to treat palliatively, because some cases you cannot cure. There are much advanced case. So in that case, your scope will be limited, and you will also deal with the patient accordingly. So if a patient of diabetes mellitus, say type 2 diabetes mellitus, comes to you with, say, heart problems, he may have also renal problem, kidney failure, he may have 2 or 3 blocks in the heart. You may have some
Yes,
patient
yes.
like this. So
Yes,
that
yes.
patient, it's a dangerous patient, If you
Yeah.
withdraw his medicine, because his nephrologist or maybe his cardiologist giving him some medicine just to manage his life. Now, if you take out his medicines, then his kidney, maybe it was in phase 2, and the next month it will go to phase 3 or 4. For heart, he was managing, and he may have one heart attack next month. So you
Yes.
cannot take this risk. You cannot take this risk. So it is my personal advice. You keep his diabetic medicine as prescribed by others as it is, and give your own medicine how far it works. You cannot take the responsibility of whole case in such stage. So
Thank you
you
very
don't withdraw his medicine. You can withdraw some unnecessary medicine, but the core medicine you cannot withdraw. Otherwise, you will damage his life. You will harm his life. Thank you.
Thank you.
Thank you very much. Anybody else?
Assalamu alaikum, sir.
Walaikum salam wa rahmatullah. Sayyid Ahmed Bolen.
Thank you for your nice presentation. Sir, I have one question.
Yeah.
What investigation can help us to identify type 1 or type 2 diabetes?
You
Which-
see, first, I understand you. There are many tests now, even to know how far insulin the person has, how far insulin reserve this patient has. Usually, if some patient comes in early age, say a patient of 20 years, 25 years, 15 years, it is type 1. There is no question. If a patient comes 50 years, 60 years, it is type 2. But some patient may be type 2 converted to type 1. He developed diabetes mellitus type 2, and he has taken treatment for maybe 20 years, 25 years. Then he lost the insulin reserve which was before. Now all his islets of Langerhans are atrophied or damaged. So this type 2 becomes type 1. So for this case, I suggest you refer the case to a diabetologist, an endocrinologist, to make this. If you have any question, any problem, even for me, I do it. I have endocrinology professor, my friends, I send the patient to him, and they will take this thing, because taking this patient type 1, type 2 converted to type 1, it is not so easy. And upon this tagging, many treatment depends. So such thing, it is better, instead of taking the responsibility on us, refer it to endocrinologist to do it for you. Okay? Thank you.
Thank you, sir. Thank you, sir.
Okay. Thank you very much. Anybody else? If there are no further questions,
Sir, how we can know, sir, how we can know how many percentage of islets of Langerhans has destroyed? Is there any test?
There are many tests now. They can measure the total insulin of the body. So this thing usually we keep for the endocrinologist. This is not our subject. For taking a patient how much reserve he has, it is better to refer this patient to endocrinologist. It is their job to do, because a homeopathic physician cannot take all this thing in his mind, and he may make mistake. So I will advise you, if you have such thing in your mind, it is better refer this patient to an endocrinologist. When they
Okay,
have
sir.
many tests nowadays, they can measure the total insulin reserve and insulin level in the blood even. Thank you very much.
As you sir told us, 70% destroyed, 80% destroyed. How we can measure? if there are any test we can do,
I
how
tell
we can.
you, there are tests. They can measure the total insulin content in the body, the blood level of insulin in the body, and they have their mechanism to make this thing. This we cannot do it. This is the matter belonging to endocrinologists. They can do it. They can tell. They can tell you that he has reserve mostly exhausted. It is more than 70%. They can tell it. We cannot tell. That's why for such thing, we refer the patient to endocrinologist. Okay?
Okay, sir. Thank you, sir.
Thank you. Thank you.
স্যার আসসালামু আলাইকুম।
Walaikum salam. Yes.
স্যার পেশেন্টের দেখা যায় যে ফাস্টিংটা 6.3 7.1 থাকে এবং এভিএফটা থাকে হলো আপনার 10 8.9 এরকম, কিন্তু স্যার হিমোগ্লোবিন A1C আবার যখন করা হয় তখন দেখা যায় 6.5 6.3 থাকে। স্যার এটা উইদাউট মেডিসিন, স্যার ম্যানেজমেন্ট দিয়েই পেশেন্টকে আর হোমিওপ্যাথিক মেডিসিন দেওয়া হচ্ছে, কিন্তু স্যার এটা কি পেশেন্টের কোনো হার্মফুল কিছু হবে কিনা?
If hemoglobin A1C, it is 6.9 is the highest limit. If it is less than this, of course it is a safe case. But it is only an average of 3 months. HbA1c, this is an average only. So correct one is when you make it on daily basis by fasting blood sugar. So if it is fasting blood sugar, and if we find, I told you before, there is diabetes mellitus and IGT, impaired glucose tolerance. If the person has fasting blood sugar more than 7.1, or after 2 hours it is more than 11.1, it is definitely he is diabetic. But if his fasting blood sugar is less than 7 but more than 6.1 in between, this is called IGT. You understand? So you take him as a patient of IGT, pre-diabetic, and you can give him good homeopathic treatment so that he does not develop into full-fledged diabetes mellitus. And you can control his diet and lifestyle and exercise. It will be all right. There will be no harm. Okay, thank you.
থ্যাংক ইউ স্যার।
ডক্টর রাজুদার স্যার, আপনার প্রশ্ন করুন, মাইকটা আনমিউট করে স্যার।
Yeah, good evening, sir.
Good evening.
If any patient come to us, good evening. If any
Yes.
patient come to us, we 10 to 15 years he is continuing, 10 to 15 years he is continuing the allopathic medicine, glimepiride, metformin, and other things. After 15 years, he has in normal limit. At that time, can we switch over to homeopathic treatment, stopping the medicine? And she is diabetic type 2.
Okay, thank you. Thank you for your answer. He said, you understand, he said that the patient of diabetic type 2 patient came 10 to 15 years taking.
And
I
also,
understand.
he has no any complication, any
Good,
complication,
good.
no heart disease,
Yes,
or
good,
any
good. I understand. You know, a patient of diabetic mellitus type 2, if he takes medicine for a long time, even if his diabetic parameters are very normal, still he will develop complication after many years. But if this patient comes after 10 to 15 years without any complication, is taking only metformin. Metformin means, you see, he has enough insulin reserve, but metformin is given usually for obese patient. This will control his obesity, and his obesity is controlled. He will need his insulin resistance will be lessened. That's why this is the case. So I think this is a good case of homeopathic physician. But in the beginning, you should not remove his metformin. It is my suggestion, because metformin gave, you can remove, but you will have to make his regular test. If it is within normal, okay, metformin you withdraw. But if you find that after withdrawing metformin, his blood sugar level is going very high, then my suggestion is you start homeopathic treatment along with metformin. And after treating sometimes, if you find that his blood sugar is getting better and better, then you can remove metformin. Metformin is not a very essential drug. This is secondary drug. You understand me? So I think in this case,
Thank you so much. Thank you so much.
If he has no complication, only metformin, yes, we can accept. Thank you.
Thank you so much, sir.
Okay, thank you. Welcome.